Hi, this is Dr. Anton Fakori and Dr. Dan Gromas to demonstrate reduction technique in posterior elbow dislocation. One technique is having the patient in prone position. Dr. Gromas will demonstrate where the patient can be in a supine position. What we're doing here is reducing the elbow by pulling down while the gurney acts as countertraction. The olecranon is posterior, and you're pushing down on that olecranon, simultaneously pulling down the forearm. And once you feel that pop, then you maintain the elbow in flexion, put the posterior splint on, and put them back in prone position, and get x-rays thereafter. Again, demonstrating on the x-ray, this is the posterior elbow dislocation. The olecranon is posterior, and we're pulling down on the forearm, and it's simultaneously pushing down on the thumb while the gurney is acting as countertraction against the arm.
The alternative approach is basically use your own arm as a fulcrum. Use the patient's arm and your hand as a fulcrum. So they're going to probably be in a position similar to this. You'd supinate their hand, interlock if possible. I've got a long arm, so sometimes this isn't always possible. But interlock or somehow grab their hand, get them supinated, and simply, while using your elbow buried into their bicep, use your arm as a fulcrum to pull up and provide traction. And again, you can assist by applying some olecranon pressure here, coming up this way and bending the arm. And then once it's in, you'll feel the pop, you hear the pop, and you can hold it 90 degrees and provide posterior slip.
Prior to reduction, we want to demonstrate that the neurovascular is intact, so we want to make sure that the radial pulse and ulnar pulse is intact. Very simple motor sensory examination consists of the sensory of the median nerve, demonstrated by sensation of the index finger, ulnar nerve, the small finger, and the radial nerve, first dorsal web space. The motor is the finger abduction, make sure that's intact for the ulnar nerve, flexion for the median nerve, and finger extension for the radial nerve. So you want to test it before reduction and after reduction.